Welcome back. For obvious reasons, many of us have had telemedicine visits over the last year, but even before the pandemic, virtual visits with healthcare providers were moving forward and growing in popularity, a little more sophisticated, if you will. At Spectrum Health, virtual on-demand visits have actually been around for about 5 years, and the health system continues to step up its game. Here to talk about this is Dr. Joel Lopez, Spectrum Health's Division Chief of Urgent Care and Virtual Health. Good morning. Thanks so much for joining us.
Good morning.
All right, so what's new in virtual care at Spectrum Health? And it's so surprising to me that this has been around for 5 years with you guys.
Yeah, it's been around for a while, but this year we're really excited about the new Spectrum Health app, and then specifically the integration that we have with the TytoCare device that we included last year.
And what exactly is the TytoCare device? How does it work?
Yeah, great question. So just holding it here, it's a device that patients can use at home and have different attachments, such as the stethoscope or otoscope. So really kind of getting that in-depth heart, lung sounds, and throat, as well as inner ear exam. And it really enhances the virtual visit. So you don't need to have one, but from a provider physician standpoint, it really adds to the care that I can provide over a virtual platform.
So who do you recommend get something like this, and how do you go about getting one?
Yeah, great question. So myself, I'm a father of 2 young daughters, so obviously I see the resource or kind of the need for families, but it's not just for families. It's for anyone who's able to have a busy life, but also want to address their healthcare needs. And so having this device to be able to be on the move and kind of avoid the office is really great. And I think that's something that we've heard from the patients. They really love it. They're able to do it conveniently at home, but more importantly, on the provider side, is we want to make sure that it's something that's technically good. And that's something that we've heard at Spectrum, that our physicians and PAs and nurse practitioners really feel that the quality of the exam that they can obtain virtually is just as good as the in-person kind of office visit. And so they've loved it, both the patients and the providers.
So people always think, oh man, of course, I need one more device in my life. Like, really? So how easy is it for it to be used? And are you guys there to kind of walk people through it?
Yeah, absolutely. Great question. So this is a device it's made for non-clinical people. It's FDA approved for anyone in the community to really pick up this device, put the otoscope in there and really get a high quality video that shares with the provider. Same with the heart and lung sounds. But this is something that you could have never been associated with healthcare before, and really pick it up out of the box and use it right away.
So if, let's just say, today I need to go ahead and use the TytoCare, how would this all work as I dial into you guys to do the telemedicine? How does this work? Do you guys actually, I put it up to my son's ear and you guys are able to see the video back, or explain that?
Yeah. So from the standpoint of talking through with the provider, you go through your symptoms, but if there was an ear exam that was needed, you can just add the attachment.
Okay.
And then just literally place it within the ear. And the provider on the other side can see that virtually and see your son's ear and say, oh, unfortunately, there is an infection, and really kind of go through the next steps on making sure that we get your son back to feeling better.
That's fantastic. Okay, so because my child goes to see a pulmonologist, we have an upcoming, 6-month visit or whatever, and we know he's doing great. So is this a situation where I can use this on those regular visits rather than going in there and being like, yep, he's great, no need to come back, see you in 6 months?
Yeah, and then absolutely. So that's a great scenario for individuals who have chronic lung disease, such as asthma or COPD. And one of the nice things about this device is those heart and lung sounds are saved within our electronic records. So we could say, oh, your lungs are sounding better here in March, but when we access your chart, we can listen to those heart sounds or lung sounds from last year, a couple of years ago. So that integration within your chart really enhances your care.
Is this a situation where, let's say, Todd, who's my co-host, maybe he has something going on with his daughter. Could he say, hey, do you mind if I borrow that TytoCare device?
Yeah, so the device is shareable, so it can be used amongst different individuals within your family, but it all connects back to the Spectrum Health app, and that's really the front door to having that virtual visit.
Oh, that's really cool. Hey, so what's next on the horizon?
Yeah, so we're excited about growing virtual. Obviously, the pandemic, spurred that. So we quickly added all of our providers on to be able to provide virtual visits, and a lot of the clinical support staff. So for us, we're really looking forward to opening up access for the community, keeping that care local, back with your providers that you have here and you've seen and establish that relationship with. But also, when we think virtual, a lot of times people think, what's it going to cost me? And really, virtual it's at a lower cost. And so we really want to just keep that patient at the front and center, and increasing access, keeping it local, and lowering the cost is absolutely aligned with that.
And do most insurance companies cover the Tyto that you're aware of?
They do. Okay. They absolutely do, which is great to see that progression, that making it open for everyone.
All right. Thank you so much. What a fascinating device. For more information, go to spectrumhealth.org/TytoCare. That's TYTO care, TYTO care. All right. Thank you so much for your time.
Thank you. Have a good day.
You too. We'll be right back.